we're going to do related and referral joint clearing for the entire upper quarter. And I'll start at the TMJ and then work my way through the upper extremity. This first round, I'll be kind of talking about clinical things and things that you're looking for and thinking of, and then I'll do a speed round where you can just practice. All right, so what we're going to do is you're going to be sitting up tall. Ideally, your feet are supported, and I want to make sure I'm at eye level with the patient. If he's sitting down low and I'm standing above him, he's going to either give me his face or he's going to lean forward, and that's going to change jaw dynamics. So you want him sitting up tall. I'm going to get right in front of him. What I'm going to do is just I'm going to examine your jaw. So what I want to have you do is you're going to open your mouth for me and then close. Now I want you to let me see your teeth, so just gently see. So I'm looking for alignment in the verticality of the incisors up and down to see if he has a crossbite or any asymmetry. So I need you to kind of peel back your lip a little bit. All right, so he's a little bit off center just to start. Okay, and now open for me. And I'm looking for range of motion, see if he's normal. Now I can see that our client here, Mr. Ben, kind of deviates off to the side a little bit, so I'm already thinking, there might be some abnormal jaw mechanics, but his opening distance is good. When you come back and open, if you go slow enough, you can probably pick up a little bit of wiggle side to side. So this could be indicative of maybe disc pathology. So to clear the joint, I do active range of motion and typically passive overpressure. But instead of passive overpressure, I'm going to palpate the joint line. So I nicely ask permission, can I palpate your joint line? And then you open. And I'm palpating, and literally what will happen is you'll have your fingertips will drop right into the fossa. So you're going to be right on the joint space, and you're palpating for a click or any type of abnormality or pain. So that's a screen, and this screen would tell me I would have more work to do in the realm of the joint. But in the context of clearing, I want to know if there's any of his associated upper quarter pain that he's coming in as a chief complaint that's related to jaw movement. Okay? But you might have something else I have to treat, but that's not related to your neck pain per se. Okay? So now I come around behind you, and I'm going to have to lower the table a bit to do the next one. So what we're going to do is we're going to screen your shoulder girdle. Now, can I have you take your shirt off for me, Ben? And again, clearing joints is active range of motion with overpressure. So the shoulder girdle is movement of the scapula. So we're looking at the AC and SC joints predominantly here. So what I'm having you do, Ben, is hike your shoulders, so lift them up. And then my overpressure is bringing him up into elevation. Drop your shoulders down as much as you can. And then I overpressure down. Okay, come back to neutral. I want you to squeeze your shoulders forward, so protract. There's my overpressure there. Now with this one, make sure that you have enough of the spine of the scapula so you're not just pushing on GH and subluxing their glenohumeral joint. So my hands on the back side are on the spine of the scapula, so my overpressure is actually getting the scapula and stressing the SC joint and the AC joint. Now I'm going to have you squeeze your shoulders back toward me, and I got to create some sort of force, three-point pressure system here. So I come across here by coracoid and open them up that way. Okay, so I've done basically up with overpressure, down with overpressure, forward and back. So it's like 8 things, active, passive, times 4. And the last thing I'm going to have you do is lift your shoulders up, and now I'm going to resist you to assess elevation. So I'm getting cranial nerve 11, spinal accessory, and also some of the trap, which is C3-4. So that would clear the shoulder girdle. Now, for the next one, all right, next up we're going to clear the rest of the upper extremity. Before I torque on the shoulder, I'm going to clear the elbow. So this is analogous to in the lower extremity where you clear the knee before you torque on the hip. So what I'm going to have you do is bend for me, and then here's my overpressure. Okay, and extend your elbow, and I get overpressure there. Okay, bring it back down to here. And then when I do pronation, don't go through the hand, don't torque on the thumb at all. Make sure you're above on the radius, and do your overpressure that way, and then open up, palm up, and overpressure that way. So it takes care of elbow and forearm Okay, now what we're going to do is clear the shoulder GH. So I want to have you scratch your back. Okay, so that's flexion, abduction, external rotation, and my force couple is going to create more of that. Okay, now I'm going to reach your hand behind your back for me. So the sequencing here is it will flow fast once you practice it. So reach up overhead, scratch your back, come in here, torque into flexion, abduction, external rotation. Then say reach behind your back. Look at I grabbed his wrist right away to guide him. And now I'm going to take him into extension, abduction, and internal rotation. So the force on my arm is driving his arm that way, backwards. Tell me where the money is. Okay. The next one is horizontal adduction. So you're going to bring your arm across. This is going to challenge the AC joint predominantly. And any time in this the patient says, ouch, you say where. In this one in particular, if they point to the top of their shoulder on this crossover, then I'm really worried about the AC joint. If they say it hurts in here, I'm maybe worried more about impingement, maybe the humeral head butting up against the coracoid process and pinching the biceps or something like that. If they have pain on the back side of the shoulder, that could just be a tight posterior capsule. All of those could be contributing factors and limitations to the shoulder that might have to be treated in the future. Okay? And then the last motion we're going to do is scaption. And in this case, I'm going to actually hold the shoulder girdle down because I really want to stress GH. And I'm just going to passively lift you up and take him overhead. And if I'm not letting scapula move, GH should have about 0 to 120 degrees of motion and stop. And what I'm worried about here is any type of instability where he might feel unstable anterior to inferiorly or getting some impingement up here. Okay. All right, so that takes care of the glenohumeral joint. Now we're going to come back down to wrist and hand. So let's just have you put your palm down and just drop your wrist that way. And I'm going to do overpressure into flexion. Bring your hand up. Just relax your fingers. Overpressure into extension. Now the reason I had Ben relax his fingers is if I bring him up like this and I overpressure this way, I'm going to get passive insufficiency of his finger flexors and not really be stressing his wrist joint. So you have to remember to let them be relaxed so you can actually stress the joint itself. Okay, now take your hand that way. Oops, wrist. There you go. So now that gets my radial deviation. Then come out here and do ulnar deviation. On ulnar deviation, I'm going to make sure I'm on the hand itself. I don't want to come through here and grab his thumb because a lot of people have thumb pathology. If I do this and he says, ouch, and then I go where, it's going to end up being his thumb. So just avoid it and go right through the palm itself. Leave the thumb out of the picture. Now we're going to have you make a fist for me. And does that bother you if I overpressure any of these joints? Okay, and open and overpressure these. And I got to give your thumb some extra love, so I want you to flex like this. And I'm going to overpressure you into flexion, open up, overpressure you into extension. I can also overpressure ab and adduction, so if you bring your thumb up that way, I could overpressure this way. But typically, the flexion piece and the extension is generally what's done as a clearing. Okay? That's the upper quarter. Cross over, do the other side. All right, next up is a speed round so that you can start really just practicing the psychomotor of doing upper quarter related referral joint clearing. So we're going to start with the TMJ. So Ben, sitting up nice and tall, I want you to open your mouth for me. The patient performs active motion. Come back down. Let me see your teeth a little bit. Okay, look for alignment. Give me active motion one more time. I see a deviation. Okay, we're going to palpate the joint surface. So open. Knowing that palpation replaces overpressure. And I'm going to come around and we're going to do the shoulder girdle itself. So can you lift your shoulders up toward the ceiling? Good. Here's your overpressure. Drop them down. Overpressure. Bring them forward. Overpressure. Bring them back toward me. Overpressure. Okay. Can you hike your shoulders up? Don't let me move you. 1, 2, 3, 4, 5. Good. Okay, now we're going to move to your elbow. Okay, so I'm going to bend your elbow for me. And there's my overpressure. Straighten. Overpressure. Forearm down. There we go. Beautiful. Okay, take your arm, reach over here. Okay, reach behind your back. Horizontal adduction. Overpressure. Okay, scaption, stabilize. I get to do all the work this time. Okay. We'll come down to your wrist and just bend your wrist down. And we'll overpressure. Bring your wrist up. Let your fingers relax. Good. Neutral. You take your hand that way. Good. Overpressure. Bring it this way. Overpressure. Okay. Make a fist. Open up. Bend your thumb. Other side.